What has been your role in pioneering bone growth materials?
When we first started placing implants, we had to open the soft tissues, the gum, over the jaws and make measurements of how thick was it. We couldn't tell before CAT scans came out. And if a patient didn't have the thickness, we would say, I'm sorry, you can't have implants. Or once CAT scans came about, if we couldn't see the dimension necessary in the x-ray, we had to say, sorry, you can't have implants. And this problem came to me actually during a surgery when I said to a patient, I'm sorry, you can't have implants. And this patient, a lovely lady, just broke down and started crying. And I got distressed. So I was thinking, and since I had been involved in pioneering another bone augmentation or growth therapy in association with the University of Pennsylvania and the Gore company that makes Gore-Tex, I said, listen, I have a possible solution and I have no idea what it's going to do. It's never been done before that I know of. I just came up with this idea, but if you're game, I'll do it for you. And the patient said, go for it. And I did what I did, and to my utter surprise, 3 months later, when I opened the gum to make the measurements, I found more than enough bone for the receipt of an implant. And after I finished running around the office out of excitement, and I got on the phone with the head of bioengineering at the W.L. Gore Company and said, Todd, I just grew bone using the Gore membrane. Can you make me sheet goods? And he said, oh my God, we will make you sheet goods. And that was the beginning of a globally used, and still to this day used, technique for growing bone for dental implant purposes and also for cosmetic purposes called guided bone regeneration. The impact of what I did resulted in me feeling responsible for great things for people not only in my practice, but for the world. And if that has ever happened to a person, they know the impact of that in life. Similarly, I taught for 28 total years at the postdoctoral level, 26 at the University of Pennsylvania, 2 at the University of Maryland, and I had impact like that on people of the world because many of the practitioners who came to train at these programs went back to their home countries and they took all of this care and knowledge back home. It's a wonderful feeling.